Hey everyone, my name's Lavonne and welcome back to my YouTube channel. As you anticipate your upcoming birth, one of the very common practices in labor and delivery is for your baby to be monitored with what's called fetal monitors. And so I really go into all the details about this in my medical interventions and my labor prep classes, which I will link down below for you to check out. Super important to get you ready for your pregnancy. But today I want to show you what these monitors look like. I actually have them here to show you what to expect when it comes to fetal monitoring, and then maybe an NST if that's what you have, and I'll explain what an NST is because you might see it, and then what each of them do along the way, and then anything else I come up with along the way, talking all about fetal monitoring and specifically those monitors. But before I do that, make sure you subscribe down below, give it a like, share it with a friend, and then let's get going. A common concern that I hear when people are in labor or as they anticipate their birth is, how do we know throughout their labor that the baby is doing okay? And so that's partially what I'm gonna talk about today. This is totally just an extra bonus for you. While you're laboring at home, you are not being monitored. You don't have your doctor at home, you don't have a private nurse at home. And so the way that we know the baby's okay is by fetal movement. So if you go to my warning signs for pregnancy video, I talk about kick counts and fetal movement and how important that is. But once you get to the hospital, what will likely happen, and this is very much hospital specific, this is whether you're at a birth center or a hospital. If you're doing a home birth, it's gonna be a whole different situation that I talk about all in my medical interventions class, so make sure you check that out. But when you get to the hospital, let's just talk hospital birth in the United States, we commonly perform fetal monitoring. Now, whether or not this is a constant thing throughout your whole pregnancy or this is an intermittent monitoring, that I get into also in my childbirth class. I'm not necessarily gonna spend the time here unless you want it. Let me know in the comment box down below if you want me to talk more about that. But in general, when you get to the hospital, the common practice is that you'd come to your triage room or your labor room and they would put fetal monitors on your abdomen. Now, when you're in the hospital, we know that labor is stressful. It's not only stressful for you, it's also stressful for your baby. And there is oxygen transfer happening to you from your lungs to the baby for the entire time you're pregnant. This is particularly important in labor when we add stress to the scenario, right? That it's stressful to have those squeezes. They don't feel the pain like you feel, but they do. They have squeezes on the placenta, and the placenta is that blood flow to baby. And so we want to know that the baby is tolerating labor. Maybe you've heard of someone that you know that their baby was in distress, or maybe they had a C-section because their baby didn't tolerate labor. The way that we know that is by our fetal monitors. And so today I'm going to talk all about the external fetal monitors. I go into internal fetal monitors, which are actually placed inside of you in my labor prep and medical interventions class. So make sure you get the childbirth bundle because everybody needs a childbirth class. But I wanted to show you what these monitors look like. I want to talk about what they do and why and how they work so that you feel more comfortable when they come out once you get to the hospital. So typically when you come, what we're looking for, if you're a nurse and you're watching this, shout out to all the bundle birth nurses. When you get to triage, your nurse will probably, hopefully, especially if they're a bundle birth nurse, they're gonna feel your abdomen and they're gonna feel for the position of the baby. Hopefully baby's head down, but what we're looking for is the back of the baby towards where the heart is, not towards their booty. We're not gonna hear a heartbeat in their booty. We're gonna hear it where their heart beats, right? And so typically that's gonna be on the lower part of the abdomen. If you look here, if this baby was super smushed inside of me, I'm gonna find the heart rate somewhere about right here along the front part of my abdomen. If it's flipped this way, sometimes you can hear it through the back, but it can make it difficult. And I say this because when they go to place the ultrasound one, I'm looking for the right one, okay? This is what we call the ultrasound device for fetal monitoring, all right? It's flat, it's just literally like, looks like a piece of plastic. It's gonna plug into the monitor machine that's right next to you. We have to put some gel on it. So it's like just some like squeezy, like literally it kind of looks like hair gel, but it's not sticky like hair gel. It's just like to help with conduction. Because if there isn't that gel, there needs to be some sort of liquid substance to help conduct the signal from the baby's heart. So when I go to put this on your belly, it might be kind of cold. Some really fancy hospitals warm their gel for you, but it might kind of be like, ooh, that's kind of chilly. And then your nurse may move the monitor around to try to find that ideal location. Now, if I felt the belly, easily I may just go doop, and all of a sudden, once the volume's up on the machine, and the volume does go down, so that doesn't mean that just because you don't hear anything, there isn't a heartbeat or anything. Okay, but all of a sudden, then you hear a doom, 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 and I'll actually play it for you here, what it sounds like. Okay, so that's what you want to hear. Now, as you hear that, what I want to warn you for, to not be concerned, because sometimes, let's say, I can't really tell where baby's at. I place the monitor over here. Am I gonna hear a heartbeat on this side of your abdomen? Probably not. And you're gonna hear a bunch of like rustling, kind of, I would say it sounds like the wind, or it's like all these like grumbles, until we find that perfect location. So I say that also because it is super common that throughout labor, and most women have this on for their entire labor, that you would have to come in and adjust. Now, if baby shifts and say baby's right here and all of a sudden baby does this, what's gonna happen? You're not gonna hear the heartbeat anymore. And so I commonly hear, we lost the heartbeat, or your nurse comes in and says, I can't find the heartbeat of the baby. That doesn't mean that there's no heartbeat with your baby, okay? And in very, very, very rare circumstances would that happen. What it actually means is that the baby shifted and the monitor's no longer picking up. And it is an imperfect device. It has to be placed well and in the right location in order to pick it up, okay? So this is a huge component of what nurses do in their job. They're gonna be adjusting this. We might have to like really like get in there and get creative to help get it right at the right angle. As baby's really low in the vagina, we may like be angling it all the way like almost at your vagina. If baby was breech, okay, meaning butt down, where would we find the heart rate of the baby? I'm gonna look down here and I'm gonna go, I don't really hear much until I go up here and I go, As an alert for me as a nurse, I'm gonna go, I need an ultrasound machine because I need to know that this baby is really truly head down. And in some rare circumstances, we might be able to pick it up there, but then I would think, maybe it's breech in that circumstance. Okay, now it's an interesting fact is you're not actually technically, and I hope I don't burst anyone's bubble here, okay? You're not actually really hearing the heartbeat of the baby. You're hearing the conduction wave of the QRS, so like the peak of the heartbeat, like if you hear doo-doom, 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 like if you hear a heartbeat, it goes doo-doom, right? That first initial beat, it sends a signal here, and that translates to the fetal monitor for your nurse. So that's also why when you look at, like maybe you've seen an EKG or an ECG monitor where it goes da-da, da-da, big down, and then another little hump. The fetal monitoring machine doesn't look like that because the conduction and the actual monitor picks up a different signal. It's literally just when the beats happen for the heart, and so it's gonna look different on the monitor. That doesn't mean there's anything wrong with your baby. It's a different and entirely different learning system. We're looking for completely different things than we are with an EKG monitor, like if we're actually monitoring the heartbeat for like a heart defect. So throughout your labor, you likely will have this on your abdomen for minimum of 20 minutes. After that, you can discuss with your team if you're a low-risk pregnancy, the option of intermittent auscultation, which I also talk about in my childbirth class and has really great evidence. But you're gonna have to discuss with your provider whether that's an option for you, and that's again an entirely other YouTube video. So in general, we're assuming with this video that you're on continuous fetal monitoring for the entire time in your labor. Now, how does this thing strap onto your abdomen? Typically, and there's different devices and different systems in different hospitals, but in general, you're gonna have a soft, and actually, let me grab it. So I have an example here of the fetal monitoring like strap, I guess, and some of them have Velcro on it. This one would work with a different monitoring system that has like a little button on top where they literally just kind of strap it on and they can tighten it based on your size, but this would go around your abdomen and then would connect to either side to hold the monitor in place. And you'd wear those for the entirety of your labor, and that your nurse and your doctor are watching at all times throughout your labor. And based on our training and our expertise, we can see whether or not we're concerned or whether or not we're saying, this baby's getting all the oxygen that he or she needs, which is really what we're concerned about. I hear very frequently when people are wearing the fetal monitors that they'll want to change positions. And we know if you've seen anything that Bundle Birth does, myself on this channel, I teach all about physiologic birth and positioning and strategic positioning for labor to nurses. What we know is that position changes are really important for labor, that movement is important. And a lot of times you see a cord and you're like, I'm strapped down, I'm stuck. You're not actually stuck. So you can ask if there's mobile monitors in your hospital. You can always get up and move around next to the bed, given that your provider has checked that off, and make sure you're really safe, not on any medications that we're concerned about or something. So you definitely can move around. And what I would suggest to you is once they're on, just let your nurse do their job, all right? If you need to change positions, change positions. Sometimes when you turn to the side, we may need to move the monitor to try to find the baby in the right position. But that's meaning it's completely your nurse's job, not yours to be concerned about. But expect that you might be hearing the heart rate on the monitor, the dung, 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 and then you turn and you're like, oh, the monitor's gone, the baby's gone. The baby's not gone. And we can have periods of time where you're off the monitor and it still be safe, okay? So your nurse will see that, they'll come in, they'll adjust you, don't worry about it. You can change positions in labor, you're not strapped down, you can still do all the mobility that you need to with these long cords. Then we have our tachometry monitor, or our toco. If you hear that, it's called a toco. Now this looks different than the ultrasound machine for the fetal heart rate. So there is a difference between the two. They do completely different things. We wanna have the right one in the right place. This one probably will be on the bottom part of your abdomen, and then the toco we want on the fundus of the uterus, which the fundus is just the top part of the uterus. So if you watch my All About Contractions, where I like give birth to a ping pong ball, it's very entertaining. I talk all about what happens in the uterus when you have a contraction. And so newsflash, what happens is the top part of the uterus, the fundus, gets thicker during contractions. And so typically we're gonna see the contractions more when we place it on the top part of your uterus, meaning the top part of your abdomen. So you may have this monitor strapped on at the top part, and that is also not a perfect science. So your nurse may need to find the contractions where you're saying, I'm not seeing it. And people get upset where they're looking on the fetal monitor and they're like, I feel this contraction, but it's not registering, like they want credit. And we want you to get credit for those contractions. Trust, we want to see them. But sometimes it has to be placed in the perfect place on the abdomen in order to see them. Now, the other thing about this one is that it only tells us when the contraction's happening and for how long. So we can know the frequency of the contractions, we can know how long they are, but we cannot know the strength of the contractions with this monitor. So you may see, and I'll show you an example here, where you see the first contraction looks really big and obvious, and you're gonna see these humps. And when I talk about in my childbirth class or my coping with labor class, how contractions come and then they go away and then you have a breather. That same thing we will see on the monitor. So it comes and it peaks, it goes up, 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 goes to the strongest part of that contraction, and then it slowly goes away. Which this is what picks up that contraction. But if one is bigger than the next one, or you look at somebody else's screen that you can see somebody else in labor and their contractions look like little blips, it really doesn't mean much, to be honest, right? It completely depends on only the placement on the abdomen of how accurate or how strong the contraction looks on the monitor. But the only way we know strength is by palpation or by you telling us. So if you don't have an epidural, you would say, oh wow, that one was really strong compared to the previous one. And that's a conversation you'll have with your nurse. They'll probably ask you those questions. If not, you may see them, or you should see them, feel your abdomen throughout a contraction, because I can tell based on touching whether it's mild, moderate, or strong. That's how I know with the external fetal monitor. Now, I talk about in my medical interventions class the internal monitors. Those we can tell the strength, but this one just tells us the frequency and then the length of the contractions, not how big they are. Even if they look really big on the monitor, you may be like, I don't feel that. But it's just really the pressure sensor that's on the back of this monitor. So you can expect when you get to the hospital, you will go to a triage room or your labor room, and they will put you on the fetal monitors almost first thing. And in combination with the fetal heart rate and the contractions, that's gonna give us a window into what's happening inside the uterus. So we can hopefully identify, is there concern going on, or are we good to go, keep laboring, we're doing awesome in there, that baby is tolerating labor great. Another question I get about fetal monitoring is the fact that what if you can't hear it and you want to? Or what if you hear the heartbeat and you want it to be off, like you want to turn down the volume? And there is a volume button on the machine. You can ask your nurse about it. They may even be okay with you turning it up or down, but we can put it at a level that where you don't hear it at all. If you find it really distracting for your labor or really, really uncomfortable for you to hear through your labor, we can just turn it off. Maybe you're sleeping or something. Or some people actually find it really soothing and almost remind them that like, my baby's here. Okay, I'm here, I'm not alone. We're bouncing away. I'll do this because it's pretty fast in labor, like dung, 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 dung. So you can turn the volume up or down in labor, whatever feels more comfortable to you, and your nurse can definitely help you with that so that it's not so bothersome throughout labor. So let me show you what you might actually see on the screen. Sometimes this is white, sometimes it has a black background. I'll put just like what the paper tracing looks like on the bottom here for you to see. And you can notice that the top line is really squiggly. We want it squiggly like that. That's gonna be the fetal heart rate. And then on the bottom, you see those little humps going up and down, and that's gonna tell us when the contractions are and for how long. Now, a lot of times what I find in the room is that families get really obsessed with the monitors. And I know for me, when I'm at births, I am a nurse and I literally stared at these things nonstop all day. It is my responsibility. And so I wanna tell you that this is your nurses and your doctors, your care team's responsibility. It is not your responsibility to be, you can watch the monitor, obviously I think it's interesting too, but to be watching at the monitor and going, oh my gosh, there's not picking up, or look at the contractions or whatever. I promise you, this is like our primary thing on my head. I know when I always joke that like when I first started as a nurse, I'd go home and try to go to sleep and all I heard was the baby's heartbeat in my head. It was dung, 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 and all these different variations of what can happen. There's actual board certification in fetal monitoring that we can get as training for labor and delivery nurses in order to be experts at this. And so it's as simple as it may be. Obviously, we want it stable. We don't want it dropping down forever. But really, you have to take a class. You have to really understand what's going on with the fetal monitoring in order to interpret it. So you can look at it, enjoy it, and say, oh yeah, that one worked, or that one maybe didn't show up on the monitor. But past that, I want to just reassure you that your nurse, your doctor, they are paying attention, whether they're in the room looking at it or they're outside of the room in another patient's room or at the nurse's station. These screens are everywhere, all right? So, and there's this entire other invisible team watching it from the nurse's station as well. So if you have somebody pop in the room, they're like, hey, I'm just checking on you. I wanted to maybe turn positions or let me adjust your monitor. You're like, how did they know? Because there's this massive screen where we literally stare at it all day, every day. If I went pee as a nurse, I'd be like, can someone watch my baby? Can somebody watch my tracing? And then a nurse would keep an eye on it while I go pee for 1 minute, okay? So they're watching, they're paying attention, and the fetal monitor system can give us a window and insight into what's happening inside the uterus with the placenta, the oxygen to the baby, which is really what we care about, and then can also contribute to a decision or giving us some more information about what's happening with your labor, whether or not the baby's coming down, whether or not baby's doing okay, whether or not we're close to delivery, whether or not the cord's getting smushed or the placenta's getting old, or whether or not we actually have concern. All of that we can sort of get in a window into and can help us in our decision making for keeping both you and your baby safe through labor. Thanks everyone for being with me here today. I hope you found that super helpful and insightful, maybe a little bit of an inside scoop on what's happening in the nursing brain as well. I just want to reassure you that if they can't find the heartbeat, okay, and or it goes off the monitor, that doesn't mean the heartbeat isn't beating inside. It's just that the monitors, they're not super duper exact, they're external. We have to sort of search around and find the baby throughout your labor. That's super common. And if your nurse were to use those words, and if you're a nurse listening to this, I encourage you to watch your terminology because it can sound really scary that like, oh, I can't find the baby's heartbeat. Like, what? Hold on. You know, especially if you've been on the monitor already, or like, hold on, the heartbeat's off, or there's no heartbeat. Hold on, like that can be really, really scary. And so instead, it's that the baby probably shifted, and so I just need to adjust the monitor and try to find the best location to hear the baby's heartbeat that's already still going on in there, okay? So I want you to remember that throughout your labor so that's not something concerning to you. Also, I wanna mention, I am sitting in my office. This used to be my dining room, and this is where the very first YouTube video was filmed, fun fact. And we've converted this into our like inspo work area. And so if you see behind me is our inspo wall. And so I will link a link down below. If you have a story you wanna share, if you wanna send your picture in for us, we have a form for you to fill out where you can send that in and we will put you on our wall behind, because I think, especially when I don't get to see your faces, it helps me keep going to hear how you've been impacted by the education provided on this channel or through bundle birth in a class or bundle birth nurses. And we wanna celebrate you, we wanna celebrate your births and remember all the little bundle birth babies being born all over the world. So if you wanna send us a testimonial or a quick story or a photo, we will print it and fill this wall with so much love and encouragement for the team as we keep creating more fun things for you into the future. If you want more from me and you want to learn more and all about this and when it applies and how it applies and what your options are and how to navigate all of that, please take my childbirth bundle class. I'll link it down below. That's your extensive childbirth class to talk you through all of the steps so that you feel so confident and ready and good to go. If you're a partner, you know how to support them. That's where my coping with labor class especially comes in. That's like probably my favorite class, but I like them all. They're all super helpful. And then if you want more from me, everything is linked in the description box down below. Make sure you follow me on Instagram because I have lots more information as well over there. And then make sure you subscribe down below. And I think that's it. Until next time, make sure you flex and flow, and I will see you soon. Bye. Ready and okay. I actually talk about this in my, okay, I cracked. Here? Yeah. In my boobies? Ready, set, go.